Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, using technology to help patients manage inflammatory bowel disease. And Dean Mark Gladwin is honored with an endowed professorship. But first, a dangerous surge in the respiratory virus RSV is causing a crisis in pediatric care around the country. At the University of Maryland Medical Center, the Pediatric Intensive Care Unit has been full for a month.
We've been full as a pediatric ICU for the last month. We have been full in our pediatric emergency department with increased visits, and we've seen increased emergency department utilization across the state and across the region. So much so that we're full as a pediatric ICU. We have to send patients out of state even to find pediatric ICU beds.
Respiratory syncytial virus, or RSV, is a common respiratory virus that usually causes mild cold-like symptoms, but it can cause much more serious symptoms in young children, leading to hospitalization.
So they are breathing fast, they are breathing hard. Usually they need something called high-flow nasal cannula, which delivers humidified high flow through their nose to help relieve some of their work of breathing. Some of them need BiPAP, which is a mask that will cover their whole face, and some of them actually need to be intubated with a breathing tube in for quite some time.
Doctors believe the surge is happening because children do not have their usual level of immunity.
What we're seeing is the RSV this year started earlier, and it seems more intense in our communities. That may be a result of the last 3 years during COVID. RSV was fairly mild. And a number of children and actually their pregnant mothers didn't see RSV, and so their immune system wasn't primed and ready to fight it off, and now they're seeing it for the first time. So that infection may be a little bit more severe.
Help may be on the way in the form of RSV vaccines that could be available next year. New technology being studied at the University of Maryland School of Medicine is helping people with inflammatory bowel disease. The app helps Crohn's and colitis patients to follow their medication schedule and prevent flare-ups.
The system provides reminders when they have a dose due. It provides reminders when they've missed a dose and gives patients the opportunity to answer why they may have missed a dose. For example, they're having trouble accessing it. They provide alerts to our center and the other centers when patients are not taking 80% of their meds or more over a given period of time, so we can intervene and figure out why.
During the study, patients will be able to report on their symptoms, and doctors will be alerted if patients do not take their medication regularly.
For most patients, if they're not taking medical therapy, they will experience a relapse of their disease. And we just don't have any therapies yet that are curative. Surgery is a cure for ulcerative colitis, but it's a cure with consequences of either dealing with a chronic ileostomy or having a reconstructive procedure. So medication therapy is essential to keep your disease under control and prevent relapses and even complications that can then result in surgery.
Dr. Cross says the study will determine if the app-based monitoring system can improve adherence to medications and improve patient outcomes. In a festive investiture ceremony at Westminster Hall, Dean Mark Gladwin was formally named the John Z. and Akiko K. Bowers Distinguished Professor, an honor bestowed by UMB President Dr. Bruce Gerald. Dr. Gladwin expressed appreciation for the professorship and for the help he has received from the university community since his arrival.
At every stage in your life, I always counsel faculty, staff, young people that you have to cultivate mentors. And it happens at every level of your life. And already here, many of you have been mentoring me. I've had multiple dinners at the home of our Board of Visitors, and thank you for that. The home of our alumni, thank you for that. I've been having dinners with the presidents of the hospitals, and all of you are giving me advice and mentorship and welcoming me, so I thank you for that. I've really been impressed that in all my meetings with Bruce Gerald, with Mohan Sunta, that we talk about strategy, vision, ideas, the business of academic medicine, but they always give me advice. You should think about this, or maybe you should do this, or this is something you should prioritize. And I absolutely appreciate that mentorship. In fact, someone was asking me, what's it like there? And I said, it's incredible because I'm really receiving just high-level mentorship from so many people. So I want to thank you for that.
And that's Frontline News. I'm Larry Roberts. Thanks for joining us. We'll see you again next time.